You can start, sir.
Okay. Good evening, doctors. Welcome to our Auricle 21 days revision series live class for university exams. Okay. So today we are in Mycology 2 topic. So what are the things we are going to discuss today? So these are the topics we're going to talk today. So you can see here uh, we have first question. These are mostly short questions usually. Can be long question also. Candidiasis itself can be a long question or it can be short. Okay. Otherwise called monaliasis or Candida albicans. This is albicans. Okay, we're going to talk about it. Mycetoma. Yes, important question. Rhinospora, all are important and easy questions. Cryptococcus can be 10 mark question also, or 1 mark, or both for 1 mark, short question, long question, everywhere they can easily ask from here. Aspergillosis, another very important topic. Motherella mycosis, mycetoma, they all are same only. They all are same questions. This eumycotic mycetoma, just to confuse. Examiners might give you a question like this to confuse you, so no need to worry. This is last one, so histoplasma. Histoplasmosis. Okay, so now so histoplasma again can be a short notes only, so we'll talk about each thing now here. So Auricle, you know what are things we are having here: recorded class, live class, practical classes, exam module and hard copy sets are available. You know that foundation classes are there. You can make use of it also. Live classes, also express exam module we have, one-to-one doubt clearing session we have, and then hard copy sets are also available. And then you have a question bank, very good question bank. You can refer a lot of questions from here. Practical sessions also will be taught. And this is a subscription plan you can see, and you can choose whatever is suiting you well. And then, yes, now let's start the question. The first question is candidiasis, moniliasis, or Candida albicans. Anything it can be, right? Okay. So you know that candidiasis is usually caused by, first of all, we'll talk about the etiological agents, then we'll talk about the risk factors, and the diseases which is causing the diseases, whatever the diseases it's causing, and then we'll go to the diagnostic part, the lab diagnosis part. What are things are important here? Okay, I'm going to write it short and sweet so that every point you have to remember. Etiology, you know, the organism name is the common is Candida albicans. It's caused by Candida albicans. Okay, Candida albicans. Otherwise, also we have Candida glabrata, many species, glabrata, Candida parapsilosis, and Candida auris. Auris is the most resistant one, yeah, most resistant one, most resistant to all the antifungal drugs. This is the most common is Candida albicans. Okay, and now Candidiasis, if you see, they are called pseudo yeast. No, they are called as a, they are not true yeast cells, they are pseudo yeast. Pseudo hyphae is there, pseudo hyphae. So we usually put them into the, we put them into yeast like, we call it as yeast like fungi. We call them as yeast like fungi. I'll tell you why. Hmm. Yeast like fungi, pseudo hyphae and yeast like fungi we call. Okay, so risk factor, who all are more prone to get diabetes? First thing, start from diabetes. Diabetes mellitus number one, HIV patient, that is immunocompromised case states, steroid patient, and then pregnancy. These are the four important things you have to mention. Apart from that, anything, any immunocompromised age also, you know, age, extreme ages, okay, old, especially old age people also, they can get. So this is the common risk factors, you know. Diseases, when you talk, disease, so many diseases it causes. It can cause, first of all, usually it causes the opportunistic infection. Opportunistic infection. So it can be just the local infection, or it can cause systemic. Systemic. When you talk about the local infection, what I think you'll start from the oral cavity, oral thrush, oral candidiasis, otherwise called oral thrush. We have then, or we call oropharyngeal, also we call pharyngeal candidiasis. Okay, and then we have esophageal candidiasis. Also, we have vulvovaginal candidiasis. Vulvovaginal candidiasis, you also call it as curd-like, right? Curd-like. This is also question frequently asked. Curd-like discharge. You see curd-like discharge. Here, the pH is usually less than 4.5. Acidic pH. Okay, curd-like discharge. Vaginal discharge, vulvovaginal, oropharyngeal, oral thrush. These are the opportunistic local infection you must mention. And of course, they can cause also onychomycosis. Onychomycosis. That is the nail infection it causes. Okay. When we talk about the systemic, it can cause anything. It can cause meningitis. It can cause sepsis is very, very important. Immunocompromised patient, hospitalized patient, it can cause sepsis. Pneumonia also nowadays it is isolated. So these are very commonly seen, okay, in the systemic cases, if it goes systemic. Okay, yes. Now, what about the lab diagnosis? So when we talk about the lab diagnosis, what are the methods available? So when we talk about lab, the first one is always we do a wet mount. So in wet mount, you look for what? The budding yeast cells, BYC, budding yeast cells with pseudo hyphae. With pseudo hyphae. Okay, I'm going to write in a separate page. It's better. Okay, so I'm going to write it here. So lab diagnostic part of candidiasis. Usually the first one is the wet mount. We have so many things. Wet mount we can do. We can do gram stain, and we also do the Reynolds-Brody phenomena, Reynolds-Brody phenomenon, that is your germ tube test, right? That's a germ tube test. Okay. Then when we talk about the culture, we can culture it in different agars. SDA sabro dextrose agar we can culture. We can culture in chrome agar and cornmeal agar. These are the common things you should mention in diagnosis of candida. So now, what are the things you will write here? Here, wet mount and gram stain, both the cases you will be seeing the budding yeast cells with pseudo hyphae. So it's a gram stain, so it will be gram positive. So it will be like this. You will see like this, budding yeast cells, like this, budding yeast cells. Some places you'll see the pseudo hyphae, not true hyphae, but the pseudo hyphae. That's all. Okay. And again, in germ tube, what happened? You have to put it in the serum. If you put this colony in the serum and leave it for 3 to 4 hours, and then when you grow it, you will see a tube like this from the budding cell. You'll see a true tube is growing like this. That's called Reynolds-Brody phenomena, which is characteristic for Candida albicans. In sabrodextrose agar, you get yeast, white yeast colonies. It looks like very white color like a pasty yeast. Okay, yeast white colonies. Okay, colony. Chrome agar, you have different colors for different candida species, Okay, different color for different species. In cornmeal agar, you will try to grow the chlamydospore induction. This will be there. So if you see this, then these are the diagnosis for your candidates. It's very simple and easy. Okay, that's all. Now next question. Next question is, so everything is given here. You can go through candidates is what all things, everything I've explained it. So nothing to say. You can just see once. Okay, these are the pictures of your SDA agar. This is your SDA agar, sabrodextrose agar, germ. This is your germ tube test. This is a chrome agar, and this is your vaginal candidiasis. This is your oral thrush. That's all. Okay, that's it. Next one. Hmm. Uh, yeah, mycetoma. So we talk about the mycetoma. Usually, when you talk about mycetoma, usually it affects the skin and subcutaneous tissue. Usually, it affects the subcutaneous infection. In subcutaneous infection, what we have is we have a characteristic triad. There will be swelling plus sinus plus discharge discharge with granules. This is the characteristic triad you should know. You'll have a swelling plus discharge plus granules will be there. Okay. Now two types. There your mycetoma can be two. You might take a mother foot, all are same, the same meaning. But your mycetoma can be two types. You divide it into this like this. One is called actinomycetoma. Other one is eumycetoma. So actinomycetoma, A for apple, after A comes B. So remember bacteria. This is caused by bacteria. Okay. Whereas eumycetoma, after E comes F. So it is usually fungi. So bacteria, usually it is caused by, actinomyces bacteria or nocardia. Very common is these things. These two are more common. Whereas for fungi, you have Madurella species, Fusarium, Acrimonium, These are some species which is causing the mycetoma. Okay, so now just back to it. Now what happened here? The classic thing is that you have in the actinomyces there will be multiple sinus. Here fungus there will be only few sinus. Have for fungus, have for few, right? Few sinus. Here the granules color will be usually in actinomycetoma it is white to yellow. But here it will be black, usually black. A few exceptions like fusarium can be white color, okay? But usually acrimonium can be white color. But usually it is black to brown color granules, okay? That's it. This is the classic difference. So here you have to give antibiotics. Here you give antifungal plus surgery. Both will be indicated. Antifungal plus surgery you have to do. Okay. Now this is now what happened? When you talk about the diagnostic part, diagnostic usually what you do, the granules is the main thing, right? So whenever you take the granule, crush it. You crush and make into powder. Then you use that crushed granule. You have to crush into small substances, small particles. That small particle you have to do for one for bacteria and for fungi, some for fungi. So for bacteria, you will be doing, you know already, you always do a gram stain and culture, bacteria culture, gram stain and culture you do. But for fungi, what you do, you can put it in a KOH mount and check in the KOH mount. You'll be checking for the typical appearances, okay? And you have to go SDA agar. You go in SDA agar, that is for fungus, okay? Agar, that's it. Some biopsy things also you can do, can stain and check, but this is the common thing. So this is the diagnosis. For diagnostic, either for bacteria, fungi, you have to do all these things and diagnose it. That's all, okay? Very, very simple and easy one. Now, next, rhinosporidiasis. Rhinosporidiasis is a very interesting one. So this one, the causative agent is called Rhinosporidia seaberry. We call it Rhinosporidium seaberry. So this is very common in the ponds region, especially in South India. Okay, South India, Tamil Nadu. So here it is very, very common, Rhinosporidium seaberry. So now what happened, the patient who were taking shower there, the patient who was taking shower there, when they swim into the pond, it goes inside the nasal cavity. So clinical future, in the nasal cavity, you have what? You'll have multiple polypoids. Polypoid mass, multiple polypoid mass. So this is usually called as the strawberry. You call this a strawberry nose. They call strawberry or cranberry, any berry, okay? Mulberry, whatever it is, okay? Strawberry nose will have typical, the nose will look like that. Inside the nose, if you see, here you will see the polypoid mass is looking like this, okay? So when you do a biopsy and see, when you do a biopsy and do a diagnosis, you will see some spirules with spores. You'll see the spherules, spores like this spherules. Inside, you'll see a lot of spores on the biopsy. That's it. Okay, this is a catastic one. So treatment, always, this is a polypoid, so you do polypectomy. It's more an EMT related. Okay, you do polypectomy. That's all. Okay. Strawberry nose, spherules with spores, and you do lympectomy. That's it. Very, very simple and easy. Easy to score 5 marks. Mycology is very easy. Never miss any question. Easily can get all the things are explained here. Okay, strawberry. And even for your actinomycetoma, mycetoma, also everything is clearly explained. Mycetoma, what are the differences? Lab diagnosis, granules, all the things clearly mentioned here. Okay. And for rhinosporidiasis, I just told, you can see it also. Okay. It's mentioned here clearly. Very easy mulberry which bleeds on touch spectacles. Cannot you can't culture rhinosporidia. Okay, that's all. Now next, cryptococcosis. When talk about the cryptococcosis, we just told that cryptococcosis already we spoke. It also it causes the one of the it causes one of the opportunistic infections. Opportunistic infections. Usually, it is the one of the capsulated, very few capsulated fungi. So this is, you can say it's only capsulated. There are few more, but it's only capsulated is better. Only capsulated among all known capsulated fungi. Very few are capsulated fungi. Pigeon droplet. It usually occurs from the pigeon's droplet. It comes from the pigeon's droplet. Okay, that's it. This is the first point. Now, what you're going to say, you have clinical feature. Clinical feature, primary organ to be affected is lung only, primary lung. Secondary only when there is decreased immunity, when immunity goes down, then it affects systemic, it becomes systemic. In systemic, what happened? The main common is, that is meningitis. Most common cause of meningitis in HIV patient, meningitis. So most common cause of meningitis in HIV patient, okay? Especially when the CD4 counts goes less than 100, less than 200, the exact value, you will get this infection. So now what happened, whether lung sample or CSF sample you take, and then you do for the diagnostic, lab diagnosis. When you send for the lab diagnosis, this is again, once again, only capsule is a true yeast. True yeast is the only thing where it's a true yeast we call. Okay, budding yeast, but true yeast we call capsulator. So lab diagnosis first thing we know it is a capsulator. So you do either gram stain, or better you do negative stainings. Negative stain, right? Negative stain like India ink or Negrosin to check the capsule, to see the capsule. Or capsule. You can see the capsulated, typical, I told you it will be round shaped with the capsule surrounding like this. Yeah. So you can see the capsule very well. One thing. Okay. Otherwise, again, for capsule, you can do one more thing. You can do one more thing. That is the latex agglutination. Is again gold standard. Latex agglutination test, because again, for detect the capsule, based on the capsule you can detect it. Okay, but when it come for the culture, you have so many culture medias. So you can do, as I told you, SDA media, where you can see a white color yeast can be seen, white yeast, with typical that budding cells. Okay, otherwise, so this is a capsule, also budding like this, oval budding cells. Okay, here you can see oval budding yeast cells. Culture STA, you get yeast. Otherwise, we have special media called Niger or bird seed agar. Niger or bird seed agar. Okay. So in this one, you will see Niger or bird seed agar, because it's producing pigment. You can, the colony goes brown color colony. Brown colonies will be seen. Brown colony. Okay. Yeast colony, Niagara birds, you see brown colony, okay, and these two only. These are the main thing. Apart from that, some biochemical test if you do, you usually get urease positive. That's all. This much only. Treatment, of course, for cryptococcus, you give amphotericin B. That's okay. They will not ask you here, so you can one second. Yeah, now go to the next one and see. This is the thing. Everything is written very clearly. And I got CSF. Yeah, this is one of the thing here. This is a musicarmine stain, musicarmine stain. So you can see again the budding itself here. That's all. And of course, brown color Niger seed agar. This is Niger seed agar. And this is your India ink negative stain. Okay, that's all. Only capture everything is, you can see treatment everywhere. Very simple and easy. No any mistakes in this questions. Okay, easy to score. Very easy to score. Okay, now aspergillus. We go to aspergillus. Now we'll go to aspergillus. You know that aspergillus is also coming one of the disease that causing opportunistic infection. Opportunistic infection. Okay, yes. So again, here the important species etiology. What are the etiology? So we have three important species in here. You have to mention. One is your aspergillus niger, the aspergillus, once again, flavus, and aspergillus fumigatus. Hmm. This usually affects ear and cause, we call it as black ear. So it causes black color. So the nicer name is of black color. The colony is black, and it causes otomycosis. It affects ear, otomycosis. Here, in the flavus, the color is usually green yellow colony, but it usually causes what? Liver carcinoma. It can cause liver carcinoma, very common. Okay. Fumigatus is the one that is very commonly. This is usually gray colony, and it affects a lot of diseases. Usually it causes AB, Aspergillus bronchopulmonary aspergillus, ABPA. It causes aspergilloma. Of course, again, in all decreased opportunistic infection, so whenever the immunity is low in them, they can cause all these things, AVPA, aspergilloma, or for fungal ball, we call fungal ball. allergic alveolitis, everything it causes, alveolitis, so many things it can cause. Okay, these are the things for the aspergillosis. Now, important is the diagnostic part. And when you do a lab diagnosis, you know that first of all, I told you colony will be like this. These are the different types of colony color, but ideally when you do LPCB, when you do an LPCB, lactophenol cotton blue or wet mode, whatever, you will be seeing how you see you will see acute angle septate hyphae, acute see, aspergillus, no, acute angle septate hyphae. This is the very, very characteristic one. Okay, so they will be like this: acute angle, and everywhere there will be septas will be there. Okay, I'll show you the picture in a while. So this is the main characteristic for this thing. And of course, if you do in the culture, if you put in SDA agar, you will see it depends upon the color. The colony color will be different like this, and accordingly you can find it. Okay, yes. So I'm going to the this thing now. This is aspergillus. Now you go to the thing. This is the one. Okay, so everything I've explained to you nicely already. So you can see that there is a uh, Niger, Flavus, Fumigatus. Okay, they can everything mentioned: allergic bronchopulmonary, liver carcinoma infection, STA, everything colors, STA black colonies, everything I mentioned here. Okay, fungal balls. So acute angle septate, 45-degree acute angle septate, exactly like this. You see the picture. Okay, that's it. This one. Okay, very simple and easy. Now, I think almost we came to the last one now. Last question. So last question is about the histoplasmosis. So in histoplasmosis, we already told this comes under the dimorphic fungi. We already discussed in dimorphic fungi. Once again, no problem. So dimorphic fungi. Then you know that the disease otherwise called Ohio or darling disease we call. Ohio or darling disease we call. Sometimes caveman also. Caves disease or caveman disease. These are the different names. Okay. And which is the bird involved here? Mainly it is the bat. Bat is the main source. We can say bat is the main source of the infection. Okay. Now, what you do, when you talk about the clinical feature, it is very similar to, it mimics similar to TB. That means always lung is the primary organ in dimorphic fungi. So similar to TB. And if it's severe, I mean, if it goes to the immunocompromised state, it can cause systemic infection. Systemic infection. Okay, now the lab diagnosis. Lab diagnosis, you know, because it's dimorphic, so we will be having a yeast form and a mold form. So in yeast form, very typically asked, frequently asked one more question also, you will see inside the inside the macrophage, you will see a tiny budding yeast cells. Okay, so this small budding yeast cell will be characteristic. Small budding yeast cells intracellular. Intracellular small budding yeast cell is characteristic for the histoplasma. Okay, mold is usually here. The mold is, you call it as tuberculate form, like this. It will be like this. You see the mold, it will be like a tuberculate. We say TB, so here the shape also tuberculate, like a TB only. Tuberculate forms. That's it. Very simple and easy. This you're going to write more than enough to score a good mark. Okay. So now you can see this is a picture. I always told you. So same thing only. Everything's explained here. You can see Histoplasma capsulatum, North America, Ohio, Mississippi. This Ohio disease, darling disease, you kill, caves disease, Ohio disease. Usually to the bad droppings, TB presentation, tuberculate microcondia, narrow budding cell, that is intracellular. So this is the yeast form. You can see inside the cell, you can see inside the macrophage, you can see all the budding yeast cells. Okay, budding yeast is inside the macrophage. So this is called, so this is the yeast form. This is your mold form. That's it. Okay. So that's all. So this is for the today's topic. So very easy. So that's what mycology is, very easy topic, easy scoring topic. So don't miss any question. Definitely from today's part, 2 questions surely you will get in your exam. So revise it, and once again, all the best. Okay. We'll catch tomorrow. Thank you so much.
Thank you, sir.
Yeah.